Phobias are an irrational, intense, and persistent fear of certain situations, activities, things, animals, or people. A person with a phobia tries to avoid what they are scared of. However, when confronted with the feared object, the phobic person will initially experience intense fear. Studies show that for treatment to be effective, the phobic individual needs to face the fear directly. The best way to accomplish this is to expose the person to the phobia in a gradual manner. Are you afraid? Do you have a fear of flying? Heights? Public speaking? Exposure therapy may be the answer. What is exposure therapy? Exposure therapy for specific phobias is about helping you face what you fear rather than avoiding it, so you habituate to the anxiety until it extinguishes. Through exposure therapy, the therapist focuses on the thoughts associated with the feared stimulus, as well as teaching you skills to help reduce the physical manifestation of anxiety that occurs when the phobia stimulus is imagined or experienced, known as anxiety management training, AMT. Exposure techniques are used when the disorder involves excessive avoidance, and treatment aims for both activation and modification of the fear structure. AMT, on the other hand, is used when anxiety pervades daily functioning. Exposure therapy is a proven and effective therapy approach to treating various anxiety disorders, including phobias. There are rules that patients and mental health professionals follow when it comes to conducting exposure therapy. In order to conquer the fear, patients will have to expose themselves to the fear-inducing stimulus. They will remain in the exposure situation long enough for their anxiety to decrease, and are no longer frightened. In doing so, they will overcome their natural reaction to avoid contact with the source of their fear, and will learn there is no need to fear the stimulus. Patients will progress at their own pace. Some patients will progress quickly through the process, while others will require more time to become habituated. Although some discomfort will have to be endured, they will be able to stop if necessary. It is hard work to face fears of this magnitude, and participating in exposure therapy will demand courage. Courage can be defined as acting in the face of fear, or being scared and doing it anyway. Every step closer to the stimulus a patient makes is a triumph. The therapist may gently prod a patient to push further if they are reluctant, but many patients find it easy enough that they tell the therapist they are ready to proceed. In vivo, or real-life exposure therapy, a proven, effective treatment technique, has been used to treat phobias by exposing the patient to the phobia via real-time exposure or computer graphics. Exposure is gradual, with small steps taken, until the patient is comfortable with their phobia. Patients are encouraged to spend as much time at each step as needed for their anxiety to decrease. No two patients are alike. Some patients may require more treatment sessions than others. As in vivo exposure can be a highly effective treatment, many phobic disorders require special accommodations to accomplish an exposure. Fear of flying typically requires access to airports and planes. Fear of public speaking requires the availability of groups of people standing by. Arachnophobia. Good luck finding available spiders of varying degrees of scariness. Consequently, in vivo exposure therapy can be costly because it usually requires leaving the therapist's office and therefore extended sessions. It can also be quite time-consuming and a logistically challenging treatment approach. An alternative to this type of therapy? Virtual reality exposure therapy. VRE therapy. The answer? Maybe virtual reality exposure therapy is the answer. Some of the most valuable aspects to virtual reality exposure, VRE therapy, beyond its effectiveness, is its ability to overcome the challenges often faced by in vivo exposure therapy. Virtual reality, VR, offers a new human-computer interaction prototype in which patients are no longer external observers of images on a computer screen, but are active participants within a computer-generated three-dimensional virtual world. VR is a revolutionary technology that integrates real-time computer graphics, body tracking devices, visual displays, and other sensory input devices to immerse a patient in a computer-generated virtual environment, VE. VR is a type of exposure therapy in a clinic setting that is safer, more time-efficient, more reliable, and less costly than reproducing the real-world situations. Situations can be created that are difficult to find in real life, and it's more realistic than imagining the danger. In the mid-90s, top behavioral scientists and software engineers teamed together to develop some of the first virtual reality software in the field of behavioral health to test whether VR could treat the fear of heights. The patient is presented with a computer-generated view of a virtual world that changes in a natural way with head and body motion. Virtual environments differ from traditional displays in that the computer graphics and various display and input technologies are integrated to give the patient a sense of presence in the virtual environment. A sense of presence is essential to conducting exposure therapy. Studies have proven a patient must experience a feeling of being in the situation in order for treatment to be successful. It is essential a person feel the exposure is real. For example, if the patient has a fear of heights, having the patient stand on a platform with a railing will allow the patient to have a sense of standing on a balcony. For the fear of flying, the patient would sit in a chair that vibrates to give the sense of an airplane moving. And standing behind a podium can give the sense of giving a speech if the patient has a fear of public speaking. The patient needs this sense of presence, of immersion in the reality, rather than just watching a picture on a video screen. VRE therapy provides the sense of presence. Let's look at the advantages of virtual reality therapy. VRE can accomplish the same exposure as in vivo within the standard therapy hour, usually 45 to 50 minutes, and within the confines of the therapist's office. In vivo exposure leaves much to chance, with the therapist left hoping the traffic is light, or the elevator doesn't stop, or the airplane encounters turbulence. VRE allows the therapist to have total control of the phobic experience, without leaving the therapist's office. Therefore, VRE poses less risk to patient confidentiality or public embarrassment by conducting therapy in the safety and privacy of the therapist's office. Many stimuli for in vivo exposure are expensive and time-consuming to arrange. Thus, VRE may offer a time and cost-effective manner in conducting exposure therapy. Precise repetition is practically impossible in vivo exposure, whereas VRE permits segments of any phobia to be repeated, allowing the patient to gradually reduce their fear and anxiety. Healthcare professionals can use virtual reality software, a head-mount display or HMD, motion-inducing or raised platform, headphones, and a cued smells generator to help deal with the patient's avoidance to their phobias. The equipment settings can be customized for each patient to make the exposure experience individualized. The HMD is connected to the computer and sensors pick up any head moves the patient makes. The headphones simulate any sounds for the environment. For example, an airplane engine for the fear of flying. The person is an active participant in a computer-driven, three-dimensional world, responding to the virtual situation as if it were real. This tool discusses the use of VRE therapy for patients with the fear of heights, fear of flying, and fear of public speaking. The environments are convincing, and for most people with phobias, it's real enough to elicit their fears. The advantages of virtual reality are becoming very evident. First, the therapist can carefully control the amount of exposure in each session. It is easier to get patients with phobias to agree to exposure therapy if it is started virtually. By definition, someone with a phobia wants to avoid what they are afraid of. In 1995, Dr. Barbara O. Rothbaum, Ph.D., of Emory University, and Dr. Larry Hodges, Ph.D., of Georgia Institute of Technology, first used VRE therapy in the treatment of patients with a fear of heights. So let's start with how VRE therapy can help patients with acrophobia. Acrophobia, otherwise known as a fear of heights, is defined as a pathologic fear or dread of high places, resulting in extreme anxiety. Virtual reality can assist the patient in overcoming that fear. 1 in 20 adults are affected by the fear of height. These patients may search for something to cling to, or may be unable to trust their sense of balance if exposed to a height. Common reactions to this fear include descending from the height, crawling on all fours, or otherwise lowering the body. Symptoms can include shaking, sweating, heart palpitations, and the patient may even cry or yell out. They may be terrified and paralyzed and have trouble thinking. Depending on the phobia's severity, some patients endure it with distress, whereas for others the fear is so intense, height situations must be avoided altogether. Some may not be able to see a physician if his office is on the 5th floor, will not take a job because the office is on the 10th floor, or will not visit friends that move into an apartment 3 stories up. A certain reluctance to heights is normal and may be partially ingrained in people as a survival mechanism, but anyone experiencing acrophobia should seek treatment. Traditionally, actual exposure to heights is the most common therapy for the phobia. However, several research studies have shown VRE therapy is proven effective in treating acrophobia. Each stage or level of exposure can be repeated until the patient is comfortable with the experience. The VR height environments have included balconies, elevators, and a series of bridges. Let's look at the available environments. In VRE therapy using balconies, a patient feels as if they are standing on an open balcony at varying floors. The patient can be placed in a glass elevator. Again, the patient should see the floor numbers rise, and the views should change depending on the floor level. The bridges environment places the patients on footbridges at different heights, and a bridge that is not as solid and has rope railing and slats. Since the original groundbreaking research of the mid-90s, there have been numerous studies in various countries all demonstrating the efficacy of treating acrophobia via VRE. The fear of flying, or aerophobia, is defined as a fear or strong dislike of flying. The fear of flying can have a devastating impact on the patient's quality of life. With proper treatment, however, they can learn to manage and even beat this common phobia. The fear of flying is estimated to affect as many as 25% of people. Some people with a fear of flying are reasonably comfortable at the airport, but begin to experience symptoms just before boarding the plane. Others have difficulty that begins as soon as they reach the airport, known as anticipatory anxiety. These pictures depict one of the first VR programs created for fear of flying back in 1997. Despite the moderate visual quality seen here, these images represented some of the most cutting-edge computer graphics for such an application. Moreover, from fear of flying to heights to other software programs, the history of VR in the field of behavioral health has proven that visual quality of images does not predict effectiveness of treatment. As you will see, however, with improved software development programs and capabilities, the fear of flying software available to clinicians has evolved quite a bit over the last 15 years. Take a look. 1997, 1999, 2000, 2005, And finally, 2011. VRE therapy for fear of flying is conducted in the therapist's office and offers many advantages over standard exposure therapy. These advantages include decreased cost, decreased travel time, complete control over the virtual flight, and shorter therapy sessions. In VRE therapy, the patient is seated in a window seat in the passenger cabin of a computer-generated virtual airplane, in which they experience many of the sights, sounds, and physical effects of air travel. With a few simple clicks of the mouse, the therapist can expose the patient to the different aspects of a complete flying experience. Patients experience anxiety as if they were actually on a real plane. The patient's experience is augmented with the use of vibrotactile feedback, provided by a chair or platform with a specially designed speaker underneath. Thus, one can feel the turbulence outside and other mechanical bumps often associated with flying. In VRE therapy, the patient is gradually exposed to a hierarchy of flying situations, such as being at the airport, sitting on an airplane with the engines off, sitting on a plane with the engines on, taxiing on the runway, takeoff, flying in good and bad weather, and landing. At every step of the virtual flight, the therapist can see and hear what the patient is experiencing in the virtual plane. You will now be shown a video of flying in bad weather.
This is the captain speaking. I've just been notified by the National Weather Service that we will be passing.
For many people, the mere thought of public speaking makes their palms sweat, heart race, and their stomach churn. The fear of public speaking is the #1 fear of adults in the United States. Fear of public speaking is the most common type of social phobia. Up to 88% of individuals in the United States with social phobias have the fear of public speaking. There are effective treatments, but many people do not seek treatment. People who suffer from the fear of public speaking, aka glossophobia, tend to freeze in front of any audience, even a couple of people. The fear may happen in the workplace, where the manager experiences panic attacks at the thought of making a presentation to his or her superiors. It can happen at home, where the job seeker becomes emotionally distraught before going on a job interview. The thought of speaking in public can leave us frozen with fear. It can also cause us to miss out on many academic, social, and career opportunities. Patients can practice giving a speech they have memorized, giving a presentation that is input into the virtual reality computer, or simply talking in front of a group. Audiences can be modified to respond to the speaker in an attentive or distracted manner, creating many options for treatment situations. Virtual audiences allow exposure for the fear of public speaking. The VRE environments, including a classroom setting, a conference room table, and a large auditorium, allow a patient to face an audience the therapist can control. Therapist commands permit control over behavioral responses of the audience: applause, bored audience, interested audience, mixed reaction audience, and others. Prepared text, outline, notes, speeches, etc., can be loaded in the environment as a text file and scrolled along the top of the podium so it may be seen in VR. The classroom environment is the first of 3 virtual environments for public speaking. The patient stands at the front of a classroom full of seated people who can ask questions and respond in a variety of ways. The interaction can be improvisational or with a planned talk presented in the virtual podium. The second scenario includes a 5-person audience seated around a conference table. With therapist-controlled commands, The basic behavioral responses of the audience to the speaker, applause, bored audience, interested audience, mixed reaction audience, can be created as the interaction unfolds. In the largest audience scenario, the patient is positioned initially behind a curtain on a stage, and when the curtain opens, they are facing a large auditorium filled with people. The large audience can be heard talking amongst themselves behind the therapist-controlled curtain. When the curtain opens, the field of view is filled with people, clapping, positive energy, neutral, and 9 other audience behaviors. If you dread cell phones ringing, people falling asleep, getting up to leave, and ignoring your speech, these virtual audiences can help you prepare. Are you afraid? Do you have a fear of flying? Heights? Public speaking? Exposure therapy may be the answer.